Yesterday, the late Diane Keaton's family confirmed that the actress's death was actually a result of pneumonia. The 79-year-old, who was well known for her roles in movies like The Godfather and Annie Hall, died at her home over the weekend.
Our 90s medical expert, Dr. Pyle Coley, is joining us now to talk a little bit more about pneumonia. Dr. Coley, good morning.
Good morning. What a loss for us, right?
Absolutely, man. I love Diane Keaton.
Me
First
too.
Wives Club was a movie I watched over and over.
Yeah.
What can you tell us about pneumonia? Because her death has got a lot of people talking about it.
Yeah, so pneumonia is essentially infection or inflammation in the lungs, and it can be caused by a variety of different organisms, bacteria, virus, or even fungus. And actually in older individuals, there's even something called aspiration pneumonia, where your swallowing is not as strong as it used to be. So instead of the food going into the food pipe and the stomach, it ends up in the lungs and causes inflammation. So that's kind of a chemical pneumonia that can happen. And when you have pneumonia, essentially what happens is the body goes into full-blown inflammatory response in the lungs. So it sends all these infection-fighting cells and they fill up the air sacs with fluid. So you can't oxygenate your blood anymore. So think about like a sponge that's supposed to be dry to help exchange the gas and put oxygen in your blood, take out the carbon dioxide, it starts to fill with fluid. So you can have trouble with oxygenation. And then if the infection spreads to your blood, it can even lead to death.
Wow.
Are there any warning signs leading up to this? Can you tell that something is going on?
For most young people, Lauren, yes, you can. But in older people, sometimes the sign could just be something as simple as confusion. So usually what you see is the usual classic triad of pneumonia is fever, cough, and shortness of breath. And, you know, if you have a bacterial pneumonia, the fevers tend to be higher. Viral pneumonia is a little bit lower. You're coughing because the lungs are irritated. And then you're short of breath, again, because you can't oxygenate the blood. If you put an oxygen probe on, you might even start to drop your oxygenation. But sometimes in older individuals, it's just something as simple as confusion, not quite being themselves, being a little bit more fatigued, especially if they have a viral pneumonia, because their immune system is not able to mount that fever and declare itself. And they may not be able to complain of shortness of breath or chest pain or what have you. So it really behooves the rest of us to pay close attention because we shouldn't be losing people from pneumonia.
Right, absolutely. Well, you know, especially younger people, it doesn't seem that big. You know, we say, oh, they got pneumonia, they're likely to recover right there. Diane Keaton was 79 years old.
Yeah.
This seems to be a bigger risk for older adults.
Much bigger. And the reason is as we get older, our immune system just isn't as good at clearing those organisms. Our lungs mechanics actually change. So the lungs become less elastic and they just become stiffer. So if you take a stiffer lung that isn't working as well at baseline and fill it up with fluid, you're more likely to end up with a complication like end up on a ventilator, end up in the intensive care unit, or even have the infection spread to your bloodstream. And then as you know, older individuals also have other types of comorbidities, hypertension, heart disease. If the lungs aren't working, it's putting stress on the heart and the brain and all the other organs as well.
So there are factors that will maybe predict if someone will do worse with pneumonia then?
There are. So these are sort of three categories of factors. One is the host factors that I talked about, your age, your kind of health status. The other is the organism you get infected with. So if you get infected with the milder organism that you can clear at home, that's called walking pneumonia. Yeah. Sometimes we'll just give people antibiotics at home. But if you get something like MRSA, methicillin-resistant Staph aureus, or another organism, oh boy, then you're going to end up in the intensive care unit, even potentially as a young, healthy person. And then the third is your immune response. So sometimes your immune system overreacting can actually make the problem worse. We saw this during time of COVID as well, where the immune response was actually worse for the lungs than the infection itself. And that can develop a condition called acute respiratory distress syndrome, ARDS, where you just can't get off the ventilator, basically.
Okay, well, leave us with some hope. What are some ways that we can reduce getting pneumonia?
So the great news, highly preventable. 41,000 Americans die from it every year, but that shouldn't be the case because it is preventable with the Pneumovax, which is the pneumonia vaccine. So everyone over the age of 65 needs to go and get that. Make sure they're up to date on that. That prevents against bacterial pneumonia.
And that's covered by insurance for a lot of people?
Yeah, for sure, because it's a preventive thing. So over the age of 65, it's covered. If you're under 65 and have other chronic lung disease like COPD or what have you, asthma even, you might be covered as well. If you smoke, you vape, you do marijuana, any of that stuff, you are destroying the immune system of your lungs. You got to stop doing that. And then you want to make sure you're just keeping a healthy lifestyle. At the first signs of any infection, it's really very important to make sure you get checked out, especially if you're over 65, because you want to make sure that you don't wait too long, because sometimes that can be problematic.
All right, good advice, Dr. Coley. Thank you very much. We appreciate it.